Hello, my name is Sophia Guzman, and for our pediatric class, I got assigned fetal alcohol syndrome. So let's get into it. So first to begin, we're going to go over the etiology of fetal alcohol syndrome, or as abbreviated would be FAS. So what is FAS? FAS is a condition in a child that results from alcohol exposure during the mother's pregnancy. When one is pregnant and consumes alcohol, this would then lead the alcohol into the bloodstream, leading to the baby by crossing the placenta. So through this, the more alcohol that is consumed, the greater the risk of damage for the baby. It is advised that women who are pregnant, or as soon as they do find out that they're pregnant, do not consume alcohol for this reason. Also, the risk is present at any time of the pregnancy, no matter how early you may be in the actual pregnancy itself. So you would just want to be cautious if you are trying to get pregnant in the future. FAS does affect babies while in the womb, and another way that we would be able to know if your child has FAS would be either detected right after birth or commonly found from the ages of 8 months to 8 years of age also. Next, for characteristics and common symptoms, we have categories that children can be affected by FAS, and these are physical defects, brain and central nervous system problems, along with social and behavioral problems. So typically under physical defects, you would have distinctive facial features, which can include small eyes, having a very thin upper lip, a short upturned nose, and a smooth skin surface between the nose and the upper lip. There would also be possible vision difficulties or hearing problems, along with having a smaller head circumference and brain size. And then another physical defect that could be a possibility would be heart defects and problems with kidneys and bones. When going into the brain and central nervous system problems, this would include poor coordination and balance, possibly having learning disabilities, having delayed development, having difficulties with attention spans, having poor judgment skills, and also have poor judgment skills, and along with having rapid mood changes. Going into social and behavioral issues, children would most likely have difficulties in school, trouble in social surroundings, all over just getting challenges with adapting to different scenarios in school, problems getting along with other children, and a hard time staying on task. Next, we have functional implications, and here I wrote cognitive functions, psychosocial functions, the brain structure, and the overall function of the child would be compromised from FAS just due to the development delays that they would have. And FAS is currently not treatable, but it can be managed if caught early enough. It can be managed through medication and therapy so that the child can learn to manage their own symptoms on their own as well. Along with impact of development, FAS affects having of poor growth, having birth defects, having delayed development again, behavioral problems, and neurological problems. And with this comes kids not reaching their milestones at the expected time, kids dealing with lack of coordination and poor fine motor skills, which would have difficulties in ADLs and IADLs, and I'll go more into that in the next slide on how OT can help. But pretty much the child would be facing multiple deficits at a time due to FAS, and because of this, they would be struggling in multiple areas of their occupations daily, and depending on the severity, supervision may be advised, and if the child can do things independently, then that's the main goal. Lastly, we have specific considerations for occupational therapy and how occupational therapy can aid in FAS. I wrote down on the slide that we have ADL performance, IADL performance, early intervention, and in-school early intervention as well. When considering how occupational therapy can aid a child that has FAS, the first thing that comes to mind is just helping them gain either functions that they haven't maintained in their milestone journey, along with helping them complete tasks since they have a challenge with attention and completing tasks in general, along with just practicing social skills and getting along with other children and aiding in school homework if that is a challenge area for that child specifically. Pretty much the OT's job for a child with FAS is to help them gain the confidence that they need to be as independent as possible in either their home setting, their school setting, or in their social setting that they are in. Thank you very much, and I hope you've learned a little bit more about fetal alcohol syndrome, and I hope you enjoyed my presentation, and these are my resources. Thank you.